AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. You know, have you ever woken up in the morning and your jaw just, maybe you feel like you need to pop or something's not quite right? Maybe you wake up in the morning and you just feel like you slept like this and your teeth are clenched. Do you know what causes that? Do you know what it is? Joining us today is dentist, doctor, and friend, Steve Mangan, we're going to talk about TMJ and the importance of mouth guards.
Excellent.
So, all right, first of all, TMJ, let's just level set.
Okay.
What is it?
Well, so interestingly enough, a lot of people use the term TMJ as if it's either a disease or a condition. But TMJ is an acronym that just means temporomandibular joint. So
TMJ is easier to say.
It's easier. But the temporalis bone is the bone on the side of your head. The mandible is your jawbone, your lower jawbone. Yeah. And so when you combine those, the temporomandibular joint is the joint that actually connects on both the left and the right side of your body. And those joints, that's the only joint in the body that articulates on both sides. So if you say TMJ, do you have TMJ? Well, yes, we all have a TMJ on both sides. But most people think of it as TMJ disorders or pain and things like that. So most people, when they call and say, I feel like I've got a TMJ problem, they're wanting to know, what can I do to relieve either the pain or maybe range of motion issues? They can't open very wide or something like that. Does that sound like what you're describing?
Yeah, it does.
Yeah.
Can that sometimes, though, actually be a bad tooth that could cause that pain back towards the back?
It might be. A lot of times when people have TMJ problems, it's related to stress. And there's a little thing that we all do. You do it, I do it, everybody does it. And that is, at a certain stage in our sleep cycle, we tend to grind and clench a bit. And everybody does it a little bit, but people with a lot of stress and certain, maybe there's certain personality makeups, they tend to do it a lot. And if you do that a lot, it can cause the muscles that cause your jaw to clench up or to protrude or go to the side. It can cause those muscles to go into spasm, and that is where we start having pain and problems. Plus, it can pull this little cartilage that sits in between these two bones. It can pull it into a weird place that makes it so that opening and closing is painful or limited or awkward feeling.
So is there a type of person who might be more likely to suffer from something like this? Or
anybody who tends to feel a lot of problems from stress is probably going to be more likely.
Well, that's most of America.
Yeah, it is. But there are also certain things that are triggers that make people do it. And okay, I can give you one. I'll use myself as an example.
Sure.
If I drink red wine, I usually clench my teeth at night. So I love red wine, but I've come to find out that red wine and I are not as good of friends as we used to be because of this. If I have more than a glass or two of red wine, the next morning I will wake up and I can feel that I have really been bearing down and my muscles are sore. And so I started to pursue my own treatment, which is I made myself a mouth guard.
Okay.
Well, a mouth guard does several things. It eliminates the ability that we all have. We all like to push against things with our teeth. And a mouth guard can prevent you from doing that in the same way that your brain is used to doing. And it usually gives you a little relief from that symptoms. My problem was when I wore it through the night, it bugged me. And I would wake up and it would be on my bedside table. And so I tried to figure out, okay, well, what can I do? Well, I went to a training course a decade or so ago, and I found out that for me, Botox was a solution.
No kidding.
Yeah. So I ended up on the muscles that cause you to clench right here, the masseter muscles. I'll use 10 units of Botox, and I only have to do it maybe like every 6 months. But I found that with that, I don't grind and clench as much. So it makes me more comfortable. And my own personal TMJ issues were kind of resolved by that. So I'm happy to say that that's an option that some people haven't considered.
I don't know if that's an option people would even know is out there, right?
I guess unless you go to a provider that happens to know about that.
Sure.
We all tend to lean on the tools that we're most accustomed to using and that we're comfortable with. So, if someone watching this segment says, okay, I'm having this problem and I can't wear a bite guard, they should ask their dentist about Botox. Yeah, it may be the solution.
That is fantastic. So how long, assuming that you don't seek any kind of treatment, like how long can this uncomfortable feeling persist? Is it also something that eventually can work itself back out? Or
Right. Yes. Generally speaking, most TMJ problems are self-limiting, because if you're doing something and it causes your jaw to hurt, the pain itself makes you, quit doing some of the things that you are doing. And many times with some pretty simple treatment, like for example, if you get to where you don't sleep on the side that hurts, I tell people, put a pillow under your knees so that you won't roll over and lay on that side. Mm-hmm. Sleeping on your back can help. Mm-hmm. I have people alternate between cold packs and hot packs, go to a soft diet. Some of these little, somewhat simple things that are not even really requiring a whole lot of no medicine, no treatment. Maybe an anti-inflammatory might help to do it. But if you do these simple things, sometimes it will resolve on its own. However, the same things that caused it the first time, if allowed to stand, will do it again. So if you get back in a situation where maybe at your job or at your home or with friends, things are stressful, you might have this little episodic recurrence.
Sure.
Where I say, wow, I didn't have it for a while and now my joint's bothering me again. Probably if you really trace it back, you'd realize something's triggering this.
Yeah. Yeah.
And it's nice to locate those things and isolate, trying to eliminate the things that give you the pain.
Let's go back to the mouth guard, because I would think that it's possible you can clench and grind, but not necessarily wake up with any kind of TMJ discomfort.
Oh, absolutely.
Correct?
Well,
Okay.
because like I said, almost all of us do it a little bit.
Yeah, right.
So, when you have an issue where you can see that there are little wear marks on your teeth, and by the way, people do come to my office and they have had no symptoms, just like you mentioned, no symptoms, but I can clearly see they grind their teeth. You can see the places where they've worn. And if I mention to it, sometimes they go, oh, I don't think I grind my teeth at night. And I'm like, well, these, they didn't just happen.
The evidence is here.
Yeah, I mean,
I'm sorry to tell you.
So people can be asymptomatic. They can have no idea of it. But if you are grinding your teeth, some people get treatment from pain. Some people get treatment because their dentist says, man, you're really tearing your teeth up. You need to do something different. So these bite guards that you were mentioning, they serve several functions.
Okay.
If designed properly, they can make it so that you don't have the bumps for your teeth to push against that cause these muscles to go into spasm. We can make it so that you can slide your jaw around, but you don't get that sense of pushback that our brains somehow seem to like in the middle of the night. And if you just slide around, sometimes people just quit doing it. And the other thing is that it allows your teeth to not bear the brunt of your stress. And so instead of tearing up your teeth, you might wear down some little acrylic splint, but you can make another one.
Yeah.
It's hard to make new teeth.
That's very true. Is this something that we can do over the counter, or is this something that does require a dentist plate?
Okay, so I can say either one could be a possibility.
Okay.
Most of the people that I know that try to do an over-the-counter solution, if it's very mild, that works pretty good. But people who are really committed to grinding a lot at night, generally speaking, I find that those people don't get much help from the ones you get over the counter. And the reason is that the ones that you buy at the store are usually soft and you can squish into them like you would gum. And I know that for me, if I put one of those kind in my mouth, my mind somehow or the other wants to grind and clench into it. And I end up getting my muscles more sore than when I started. So the ones that we make them hard. And the bite guards that go in, if you bite down and it feels hard like your teeth would, and there's no resistance to sliding, forward or left or right, it tends to make people not grind and clench as much. So if it's mild and all you need is protection for your teeth, probably over the counter. But if it's not, if it's more severe and you're having pain and muscle soreness, limited range of motion, you're probably going to be better off with one that is made by your dentist and that it's adjusted to your bite.
And would you then wear that forever? Or is there a way that you can stop grinding and
I
clenching?
guess it would probably depend on whether you can eliminate the source of your stress. If you're the kind of person that you're going through, let's say an episode of something, and you're going to be through it and it's going to be back to normal, you might not be wearing that thing forever.
Right.
You might realize that, okay, I'm not doing this anymore. I'm not grinding anymore. And probably you're not going to wear it. But I have people in my practice that have been wearing the same splint for years. And they say, man, I just can't even sleep without it, because they sleep so much better when they have their bite guard in. They sleep fine through the night and they wake up and their jaws are relaxed. And when they don't, they say that they clench and grind and they wake up and their jaws are sore. And nobody likes that.
Yeah.
So
that is so fascinating. Okay, in our remaining moments, anything else that we need to know either about TMJ disorders or needing a mouth guard or a bite guard?
Yeah, I can say that probably some things that you might want to consider. First of all, be aware of what is stressing you out and try to eliminate that as much as possible. I'm sure that there are people better than a dentist to talk to about how to do that. But if you're aware that, that could be an issue, address that. I would say if you recognize that there are certain triggers, like for me, like I mentioned, drinking red wine, I have to back off that. It's just something that it's not worth it for me. The other thing I can say is, if you have certain things, like for example, crooked teeth that hit funny, that make you put your jaw in an uncomfortable position, maybe that's the only place they feel comfortable, you might consider some orthodontics to bring the teeth into a place where there's harmony between how your teeth fit together and how your jaw rests up in the socket and how the muscles are. And that's a little extra thing that some people might have to look at, is if the cause of it was what we call a malocclusion, your teeth don't fit together right, then you might want to consider treating that.
That might help. Yeah. I've heard that we carry our stress in our heads, and so that would make sense that it would just kind of trickle down.
Right. And some people's it goes all the way into their neck muscles and
down the shoulders.
Yes, exactly.
Yeah. Okay. Well, this is very interesting. And Botox, who would have thought?
No kidding.
I love that piece.
Botox is my friend.
Yeah, I love that advice. Okay. Dr. Mangan, thank you so much for joining us today. Michelle. And thank you for joining us. We'll see you back here next week for more AFMC TV.